Hi everyone, welcome back. Last week we introduced the underlying constructs and history of qualitative research, and this week we're going to get into the components of the design of a qualitative study. Your assigned reading for this week is Chapter 3 in your textbook, and this provides an overview of how to design a qualitative study. So before we do any kind of design, the first question we need to ask is, when is it appropriate to use a qualitative research design? So qualitative research is appropriate when we want to explore a problem or an issue, where we need to get really a detailed, complex understanding of an issue. Sometimes we use it to explain mechanisms of quantitative studies to better understand what was happening. Sometimes we want to empower people by highlighting their perspectives, for example, the patient's experience. And sometimes we use it to develop theories about how a certain event is occurring or how it affects people. And these are just a few of the reasons why we might use a qualitative design. But what they all have in common is that we kind of need to dig deeper and understand something in a different way. So when you think about selecting a topic, what are you curious about? Where is your interest? What do you want to learn more about? What's relevant to your practice area? Where are there gaps in the literature? What do we not know already? What hasn't been done yet? What questions have not been answered? Is there a theory that you want to compare to see if it's congruent with reality and what's happening in real life? And sometimes our topics come from what we observe in our daily life. Again, this could come from your practice experience or teaching or different, your everyday life. What do you observe that you want to dig deeper into? So when we're identifying a research problem, we want to describe the context of the topic, understand why it's significant, identify where that gap in the knowledge is, and then the purpose of what our study is. So when you're creating a purpose statement for your qualitative project, you might want to use a template like this that's from your textbook. And it's just a way to structure your research purpose. Generally, qualitative studies have a broad overarching question. That's where you start, and then you may develop sub-questions as well. Your theoretical framework really is what drives your qualitative study, and the theoretical framework is the underlying structure, the scaffolding, or frame of whatever it is that you're doing. It really asks the question, or answers the question rather, what point of view the researcher brings to the study. This may include your disciplinary orientation as well as concepts or theories from the related literature that are informing your approach. And really, the theoretical framework shapes what literature is searched, how you define the problem, and how the study is actually conducted. So when you're planning your study, one of the first things you need to do is a literature review to really understand what's been done before and help you define how your study is different. You'll want to identify the strengths and weaknesses of the previous work and really understand how what you're doing is going to contribute to the overall literature, how your findings are going to relate to the prior work that's been done, and to give a better picture of the problem at hand or the question at hand. Sample selection in qualitative research is purposeful, not probabilistic. So we don't do a power analysis. We don't have a certain threshold of a sample size that we need to attain for our research to be valid. But we do want to target information-rich cases and people who are going to best be able to help us address the study question. There are a number of different approaches to qualitative sampling. And you will still have inclusion and exclusion criteria, although they may not be quite as strict as in a typical quantitative study. And again, the size is really going to vary based on, there's practical constraints about how many people we can really get for our study, how many people do we have the capacity to interview and data to analyze. So there are a lot of factors that play in, but just know that there's not one sort of magic number for a sample size. So our data collection in qualitative studies is primarily through interviewing, observation, and reviewing documents. And that's going to vary based on what your question actually is and what theoretical framework you're using. We will cover all of these approaches in the coming weeks, and you will include them in your project as they are relevant. And also with data analysis, it's very different in qualitative. We talked about last week how qualitative research is based on language and words, and although it's very different, it's not statistically based, it is systematic. So we will spend a couple weeks on that in a few weeks later in the semester. So ethical issues in data collection that might come up. They are a little bit different, each for interviews, observation, and document review. Interviews might be the most fraught just because we're having a direct interaction with another person. I think for people with a clinical background, the most important thing to be aware of in an interview is that you're approaching it as a researcher and not as a clinician. So sometimes we might feel like we want to intervene or counsel somebody, but that's not really our role in a research context. Document review is very unlikely to generate an ethical issue, but it's possible we would uncover some impropriety or unethical behavior through reviewing records. And of course, if we're reviewing things like medical records, we do have to protect confidentiality. Basically, the important thing to think about with ethical issues and data collection is to have a plan about when you need to intervene and how, what the appropriate responses are, and how we might, and if there is something that's an urgent issue, for example, a participant who expresses ideas about self-harm or harming others, that we do have a plan to act on that immediately in the situation. Finally, regarding dissemination of qualitative research, we need to just be aware of the role of the funder or sponsor in the presentation of results, if they had any role at all. This is unlikely to be an issue for you in your capstone projects, but certainly could be an issue in some of the things you read and how you interpret that. And sometimes it's challenging to keep the anonymity of participants. So especially from a small community where it's just really hard to change the details in such a way that we don't know, that it's not obvious who they are. And again, the researchers, how they choose to present their data and which data they choose to present out of the whole study. Again, ideally we want to answer that question we set out to answer in the beginning, but there's some ethical concerns just to make sure that the participants' words are accurately represented. Here are the references for this week, and have a great week.